Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today I'd like to welcome our guest, Dr. Sarah Zielsdorf, who I'm proud to say is one of the LDN Research Trust's medical advisor, and she's also our medical director. Thank you for joining us today, Sarah.
Thank you so much for having me, Linda.
So tell us, from your perspective of seeing patients who've been, chronically ill for a long time, not being believed and not getting a diagnosis. What's your thoughts on that?
Well, the first step is it's not to just throw my colleagues under the bus, because I am trained as an allopathic physician. My background is in internal medicine. I'm as regular white coat medicine, allopathic, regular medicine as it comes. I'm a board certified internist in the United States, and I practice out of Chicago, the Chicago suburbs. My colleagues and I in medical school were never trained to deal with chronic illness. For chronic diseases. That is the number one thing that you need to understand if you are chronically ill. If you have something that cannot be named, blamed, and tamed according to an ICD-10 diagnosis, such as hypertension or a fractured leg, allopathic medicine does wonderfully. If you have a acute diagnosis, if you have unfortunately been in an accident, if you have a traumatic event where you have an acute injury, we are amazing in allopathic medicine at having the surgery to fix that bone, setting the bone, and dealing with those things. We are really terrible at chronic illness. And I was at a conference this last weekend with one of my colleagues, and we really discussed with other thought leaders in this kind of healing space of functional medicine and really personalized medicine, that there really are two now diverging models of healthcare. And if you have a chronic illness, you really can't be treated by allopathic medicine. That's unfortunately number one, unless you really find a clinician that is understanding and specializing in chronic illness management, or specifically whatever is going on. Most of us that have chronic illness do not have one diagnosis that can be named, blamed, tamed, put into an ICD-10 code. And so it really means finding a team, your personal team, that is going to help you. And it's helping you from a spiritual perspective, from a mental health perspective, from, yes, the physical perspective, but many of the issues that are going on. But I will say this, if you are needing to be in the allopathic world, because say, Linda, we talked about the healthcare system in Britain and working within that model that is so challenging. The same thing with our, say, US Medicare model. It is just incredibly challenging if you have very finite resources and these are the doctors that you're able to work with. The first thing that I would say is that if you are not being believed, if you say, I have this symptom, or I've been dealing with this for however many years, and the clinician says that it's in your head or that it's not real, that you ask them to document that. And you ask them to document in your medical record that they are refusing to believe that you are saying what you are saying, and also to document the refusal to do a diagnostic test if it is a necessary test, or if it is one that is within the range of the standard of care that you are asking for and you are not being believed. So being your own best advocate is the biggest first step that I see as a real necessary thing for a patient to do. And another is to just really acknowledge in the chronic medical illness world that all of us have had trauma in that. Those of us that have been sick, on average, if you have an autoimmune disease like I have Hashimoto's, I was not diagnosed for more than 10 years. And as a doctor, I was already a doctor, well into being a doctor. all the way through my training, I had had multiple medical leaves and progressively got sicker and sicker, even though I was on the standard of care for thyroid. When it was not my thyroid, but that the thyroid was an innocent bystander, that I had a chronic autoimmune illness that waxed and waned, and my thyroid was an innocent bystander in that. But I progressively got sicker and sicker as it was not recognized that it was the autoimmunity that was the root cause. And beyond that, then the other causes of autoimmunity in my life that had and continue to be sorted. And so if on average it takes 10 years to get a diagnosis, many, many patients with chronic illness, as we discussed, Linda, are dealing with things for 20, 30, 40 years. And in that time, you can imagine you have to develop a really thick skin and a set of armor to just deal with living with these illnesses and dealing with the medical institution. We were talking about the trauma that really happens from people not being believed. And what happens is you have to just keep searching, and really, I do not want to use the word fight, because we don't want to fight against these illnesses and these symptoms. We want to keep advocating and finding people in our lives that can support us, that can help us, and that we can search for solutions. And rarely is it going to be in the straight allopathic world, unless there is one aspect of your treatment that is needed, say a prescription that helps, or a surgery or a procedure, lab work, these things. What I want to say, and we've been talking, I have a colleague also in the trust who is doing work on mast cell activation, doing documentary work on this. But that we now know that there are linked genes where people are more susceptible to developing these chronic conditions. And that can encompass dysautonomia, which is also includes POTS, postural orthostatic tachycardia syndrome. But more broadly, it affects aberrations and problems with blood pressure, with blood sugar, with ability to be able to control fluid balance, acid-base balance, many, many aspects of one's life. And that often encompasses also a spectrum of people who have connective tissue disorders, hypermobility, all the way to Ehlers-Danlos. Now, just even in the last 10 years, people didn't understand this. I wasn't trained at all on it. Maybe got a few slides on Ehlers-Danlos, knew that there were people with connective tissue disorders, but not that a lot of people don't actually formally have Ehlers-Danlos, but are on this spectrum of developing and can develop hypermobility due to different triggers if they have underlying risk factors or underlying predisposition. And then there is this overall encompassing kind of thing that people are talking about called MCAS, which is mast cell activation syndrome, which really is a spectrum. And when we talk about mast cells, people are like, mast cells? No, mast, like mast on a ship. Until the early 2000s, MCAS wasn't even a thing. It was really coined in that time. So if you can imagine all the doctors that are in our complement of the profession, think about how many trained more than 20 or 25 years ago, right? So many of them weren't even trained in this. So in their world, these things don't exist. And so I will tell you, even though I'm not a brand new doctor, I'm still relatively new, having earned my certification about 10 years ago. And being in training, until 2012. I mean, that's not that long ago. And the classification of these things has really just become mainstream in the last few years. And I think the tipping point has been COVID, really. Because of COVID, we have millions of people who have these undiagnosable things, including long COVID, now known as PASC, which encompasses things like brain fog and POTS, other dysautonomia symptoms, MCAS, chronic pain, chronic neurological symptoms, autoimmune diseases, all sorts of things. And now places like in the United States, Mayo Clinic, 10 years ago would have said, oh, this doesn't exist. Now has to say, oh, we've seen this. And yeah, it's weird. And basically I got this report from a patient that said, oh yeah, we see lots of weird things. They're having to acknowledge that these things do exist, but they don't have a framework of understanding. But in general, this mast cell activation really encompasses a lot of things with poor understanding. So for instance, there are two kind of flavors of this. You can be born with abnormal mast cells, which can predispose you to something called mastocytosis, which is where people will get chronic hives, chronic severe anaphylactic or anaphylactoid reactions, risk of developing cancers, things like that. Those can be genetic, where those mast cells, you were born with abnormal mast cells. And mast cells come from the bone marrow, just like making other blood cells. And they last a really long time. I think there was a rat study that showed that mast cells were around for 2 years. And that kind of really stuck with me because the life cycle of a rat, the lifespan of a rat is about 2 years. And so saying if you get development of abnormal mast cells, that can really last. And so these mast cells can be induced or triggered due to different infections, due to a lot of different stimuli. And so the mast cell activation often isn't the root cause of a patient's problem, but it really is an effect. Say they had COVID, say they had Lyme disease, say they developed severe intolerances to food because they've got chronic inflammation in their gut. Say they were on a proton pump inhibitor chronically for acid reflux, and then they developed bacterial overgrowths and they developed, issues with antibodies against proteins in the gut lining, leading to intestinal permeability and then an increase in chronic inflammation, which then led to chronic immune system activation, which then guess where mast cells live? Mast cells live in the highest concentration in the gut and in the central nervous system. And so we see a lot of symptoms due to elevated histamine, leukotrienes, and in fact, mast cells produce over 1,045 different inflammatory mediators. So credit to Dr. Leonard Weinstock. He talks a lot about this. For instance, mast cells produce heparin, and heparin is a blood thinner, right? Natural endogenous blood thinner. So we talk about patients who will get really severe bruising with this condition, and it's another thing. The tough part about mast cell activation is you may have 0 positive tests, which leads to doctors not believing that you have this. And so it's really this often huge challenge because a lot of the symptoms that one may have are not, we don't have the ability to actually measure unless you have an extremely well knowledgeable lab, that certain clinicians use or being drawn at a hospital and where they know what to do. And so we really have to take, as a chronic illness patient, we have to take our power back. First you have to believe in yourself and know that you can heal. And the other aspect of this is starting to address the trauma. And so I can tell you that even though I know all of this stuff, I advocate for my patients. I do the right tests. I give the right supplements. I give mast cell stabilizers. I use low-dose naltrexone, which, yes, stabilizes mast cells and really helps with chronic T cell activation, helps with, I could talk about the LDN aspects all day long, and how we have different inflammatory mediators that overreact. For instance, something called toll-like receptors, which I'm really advocating for the use of LDN because low-dose naltrexone reduces that activation, especially in the gut. And the issue is that I could do all of those things, and the patient could be doing all those things, eating the right diet, taking the right supplements, and still not make progress. Because if one is in chronic fight or flight, so we have the autonomic nervous system, which means we can't control it. It's automatic or autonomic. And there's 2 flavors of that. There's fight or flight, which is the sympathetic nervous system. It's like you're being chased by a bear. And then there's rest and digest, which is the parasympathetic nervous system. And if you've been sick all the time for a long time chronically, or say you've got chronic gut inflammation in your vagus nerve, which innervates from the brain, it's the largest cranial nerve, it innervates from the brain to the gut. And it innervates all of our organs, our heart, lungs, gut, everything. And in fact, there is a direct connection between the microbiome in our gut and our brain via these cells in our intestine, small intestine, called a neuroendocrine cell. And we have this whole new field of biology called psychoneuroimmunology. It's crazy. We just keep making bigger and bigger and bigger words and shoving it all together. I don't know if they're taking lessons from the Germans, but these words are becoming incredible. But anyway, it literally is how food and how our microbes and how everything that's in our gut, anything, any medicines that we take, any supplements, anything, that can directly influence our immune system, interfaces with our immune system and our nervous system, and really can affect how we think, how we feel, our moods, and how resilient we are against illness. And the biggest thing is if someone's in chronic fight or flight, you cannot begin to heal. And so the biggest piece for me in getting so sick that I could not work was that I had to address trauma. And that is not a one and done deal. It's in fact something that I continuously work on as things come up, because these are layers of trauma. And there are many, many ways to do this. And so finding out ways that you can do it, and you can do it without too much expense. There are a lot of free resources. Looking up what we call vagal toning, Toning, the vagal toning exercises, things like humming, gargling, singing loudly in your shower, singing in the car, things like diaphragmatic breathing or different ways of breathing, can really help support getting you out of fight or flight. And there are some more sophisticated things to do, neuromodulation, neurofeedback, many, many, many tools that can help that vagus nerve. But we have to start doing that work to get out of chronic fight or flight so that the nervous system, part of the brain called the limbic system, that feeling, what I call the rat brain, can tell the rest of the body, you're safe, you're okay, you can let your guard down, so that your immune system and your nervous system can calm down and start to do the work that it needs to heal. Because the body can heal, it can if it's given a chance. The problem is my patients and myself got into a place where we were so incredibly stressed and so traumatized and just sick that we couldn't begin to do that. So we got to give the body a chance.
Well, that's amazing, Sarah. Thank you so much. Is there anything else you'd like to add?
Just that there is this, I don't want to say renaissance, but I want to tell you that I think we've reached this inflection point, both with chronic illness, that, think about adult population, probably 1 out of every 2 has chronic illness, if not, more. Most adults over the age of 65, are on multiple medications, especially in the United States or in developed countries. But I will tell you this, that if there is a silver lining in this post-COVID or now COVID time, is that we have so much illness and so much demand and advocacy that patients like myself, who are doctors or other clinicians, are asking the questions, are getting grants, are studying, are doing the work, and are working toward solutions. And that's why I volunteer with the LDN Research Trust. That's why I teach. I teach pharmacists, and I work directly with pharmacists so that they can help their patients and get to the next level of treatment so that we can really start finding solutions, to problems that don't even have names, right? So that's the biggest aspect. And I know a lot of this feels impossible. It does. But I would say, number one must have hope. You can't begin to heal. If you lose hope, then that really is the beginning of the end. So remaining hopeful is really important. And trying and continuing to work to find a team approach, a multidisciplinary approach. Who is on your team? So if you have chronic illness, you don't have time or energy for people who are, sucking the energy out of you, time, energy, who aren't supportive, and that means asking these tough questions, and doing the best one can with one's circumstances to, you know, to change. It takes a lot of bravery. I know that. And it's a really scary thing, but I'm not talking about huge things in the day to day. but doing what one can do to remain hopeful, to remain positive, and to do their best to overcome these circumstances, to advocate for oneself and make choices, make good choices in the moment to moment and living moment to moment. So one of my friends from training, who is a physician that I just spoke with last night, it's very, very apropos. Last night, someone that I spoke with, I was texting with, she is disabled and really unable to work, and talking about just the experience and giving her some ideas of, how to get out of fight or flight, saying we got to work on this, you're flaring. With very, very, limited ability to, see clinicians, do treatments, things like that. Very, very, very challenging situation. And telling her very much the same things that I'm telling you right now, saying you've got to have hope. You've got to remain hopeful. Don't give up. And even though you're in a lot of pain, even though you're dealing with so much, it means living moment to moment if you have to, minute to minute, moment to moment, hour to hour by hour, and then day by day. Because when you suddenly realize, oh my gosh, I'm dealing with this for days, weeks, years, and I can't do it anymore, which we all do, we all go to those catastrophizing thoughts when you're chronically ill, it just is too much. It's too overwhelming. And so staying in the present moment and staying really hopeful are the two things that I could just say, please try to do that. We all have bad days, but when we can get those thoughts smaller and work in just the time frame of now, I've just got to get through now. What do I have to do now? And then make the next best decision. It does help.
Well, thank you very much. We'll have to have you back another day, Sarah.
Thank you, Linda.
I'm Dr. Leonard Weinstock, the guy who's been prescribing LDN since 2005, and I've seen the wonders. And I keep on seeing them, especially in hard to diagnose conditions. They're not that hard to do, but once you know about mast cell activation syndrome, postural orthostatic tachycardia syndrome, and Ehlers-Danlos syndrome, you'll find that 17% of your friends or relatives have one or more of these conditions, and you can help them. We're making a documentary to wake up the medical community, to educate the population, but we need funding. So please fund whatever you can afford, no matter how little. www.mcasfund.com. That's mcasfund.com.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.